The mayor of San Angelo, let me start all over. Hi, I'm Brenda Gunter, the mayor of San Angelo, Texas. We made a commitment to the public that the minute we had a positive case of COVID-19 that we would call a press conference so that the citizens understood that we want to make sure they understand what's going on and that there's no secrets out there in terms of what's happening in this community. What we can tell you is the case is a 70-year-old man who traveled into San Angelo having visited another country. And so this case is not a case of a local resident, although obviously it's still a case. We also know, in fact, that because it is a travel-related case, that it is not a case about community transmission. So that is the good news. At this point, there is only one case, and again, it's a travel-related case. What we are asking all the citizens to do today is to continue to follow the CDC guidelines. That is very important for everyone to do. The way we will continue to move forward with no more positive cases will be if everybody follows the CDC guidelines. Governor Abbott today at 2:30 had a press conference, and he once again emphasized the fact that we need to follow the CDC guidelines. And that means bars and restaurants are closed with the exception of takeout and delivery. Visitors will not be allowed in nursing homes. We must continue to sterilize, soap and water, hand sanitizers. You can't do it often enough, regardless of what business that you are in. But we also want to make sure that everybody understands what we describe as essential businesses. And so if there's some questions about what businesses are not essential, today would be the day and an opportunity to talk through that. But we as a city are not declaring a stay in place at this point in time. We are going to continue to follow Governor Abbott's declaration in terms of what will or will not be allowed to do. So with that, may we please have some questions and some comments from anyone here today from the media? First person, please come up to the microphone.
Hi, John Teff, San Angelo Standard Times. Can you tell us what country the man traveled to?
I don't know if we're allowed to do that. We cannot say.
Can you tell us when he got here?
We do not know.
Do you know if he visited any locations around San Angelo or the Concho Valley before becoming ill, or was he quarantined the whole time?
Do we have that comment? Shane, you want to comment on these questions? If the answer is no, the answer is no.
The answer is really, I'd probably ask Lena and Dr. Veredas, but basically we're still researching and kind of going through that process. So really nothing to share at this point.
Is anyone else quarantined with him?
He's the first positive case in San Angelo, so he's been isolated.
Not about that question specifically, but you know, we had our control measures in effect already. Having this one positive doesn't really change what we're doing. We were ready for that, and a lot of us in the medical community were really surprised it's taken this long to get a positive. We've had several patients that clinically we suspect probably have COVID-19, and we've been treating as if they have. We don't have positive tests, but we're ready for it.
We had a call from a citizen. This is Joe Hyde, San Angelo Live. We had a call from a citizen this morning, and he was asking about the cost of the coronavirus test. He said he was told it was $80. And I asked him, do you have health insurance? He said, no, I don't have health insurance. I said, do you have a job? He said, no, I'm a freelancer. And I said, well, so you don't have health insurance, you're a freelancer, do you have Medicaid? He said, no, I don't have Medicaid, and I'm not old enough for Medicare. So can we, I guess, find out what is the cost of the coronavirus test for various subsets of our community based upon their insurance coverage and or employment status or Medicaid status?
Okay. Would anyone like to come forward and answer that?
We basically have set up a price for the screening, the evaluation, and also a price for the testing. I know there's been some information out there federally about it being a free test. We have not received any guidance on that so far. As soon as we do, we'll change our processes. But basically what we're doing is we've set up 2 sites. Site 1, which is downtown, this is for evaluation and screening. We set up another site thanks to partner, Dr. May being so helpful in the ASU parking lot right across from the Shannon Clinic ASU location. And that site's set up also for evaluation, screening, and testing. So today we are, there is a charge involved for the screening and the testing, but we're not taking money at that point. So basically, if someone comes through, we're going to take the information down, we'll bill them at a later date, and no one's going to be turned around because they don't have their credit card or cash at these sites.
Okay, do you see that there's a gap between those that are covered by Medicaid and those that are on employers' health insurance or can afford private health insurance? There's a large gap of people there who can't afford insurance or don't have insurance. And the follow-up to that, if there is a gap, we've only tested 141 people. What are we going to do to get more people to test? And I mean, we're shutting down all our businesses here, and we don't have any data as far as how bad this is.
Specifically, what I can control is evaluating people and testing people. And that's my focus. And I can assure you that if someone comes through our lines at Shannon, through this drive-by testing, they are screened and we feel like they need to get the test, they will be tested. And then, of course, we will wait for the results. Turnaround times have been long, basically 7 days. We're looking at other opportunities, other labs that maybe have a quicker turnaround time. We found one in Austin that has like a 1-day turnaround time. But to answer your question, if someone tests positive, we're going to take care of them whether they're funded or not. It's about care and not about billing or charges. It's about taking care of our community. And that's what we're focused on and we're committed to. I couldn't even tell you about the patient that we're talking about. I couldn't even tell you if they're funded or not. And I really don't care because all I care about taking good care of this person.
Shannon's done a good job based on the other communities, our benchmark communities. The big question a lot of people are asking me to ask is the number of testing. Is there, we have 2 testing facilities. Can we really handle how many tests or how many samples are taken at each of these 2 tests? And how fast are we going to ramp up the testing here in Tom Green County?
I'd like to put a little bit to the testing. In a way, I really want everybody to get tested, but it really doesn't make any difference. If you test negative and you got the symptoms, you got cough, you got fever, you need to be quarantined at home for the 14 days, regardless of what your test status is. If you test negative, there's a lot of people that get false negative tests, and then on repeat exam 4, 6, 8 days later, they test positive. So the only value a test has is it's positive, it's got positive predictive value. That person's got coronavirus disease. If it tests negative, it means they might or might not have coronavirus. So a negative test doesn't do any good. We don't treat you any different based on what your status is as far as your test status. If you've got a positive test and you're healthy, you're not hypoxic, you're not in respiratory distress, stay home. Don't even bother coming to the hospital. Don't go to a clinic. We're not going to do anything. Just stay home. It's a virus for most people. You'll get over it. If you get sick, if you're having respiratory distress, you're hypoxic, not able to breathe well, that's when we want to see you at the clinics or at the hospital. Having a positive test or negative test doesn't affect what we do.
Obviously, nationwide, we're preparing for the worst case scenario with the spread of this virus. Locally, have y'all run any numbers, models on how many patients you can take and how many people have to be infected before this really is a disaster for San Angelo in the healthcare world?
Shane has done some terrific projections. I'll let him talk to that, but they've been on top of it. They've looked at the number of potential people in this Tom Green County and surrounding neighborhoods in terms of what the potential could be if the statistics that they say are correct. They're prepared, and I will tell you this, the hospitals, the city, we have a plan. We are prepared. We're meeting on a regular basis to ensure that the communication is there and that no question has been left unanswered to make sure that we are there and ready to respond. But Shane, you want to talk about your numbers?
What we've looked at is basically looked at our the area that we serve. We serve about 25 counties, including Tom Green County. We feel like at Shannon, our challenge to ourselves has been we need to double our capacity. And so that has been what we've been working on for almost, I'll say about half a week. My big concerns right now are personal protective equipment, making sure we have enough supplies. And I want to thank, we've been contacted by a lot of different people wanting to help us on that, and I really appreciate that. So we've been focused on that. We've been focused on working with our vendors and getting a lot of that equipment in place here locally. We've been looking at securing more ventilators, really focused on what would happen, not today, but really 30, 60, 90 days ahead of us. So my hope is that we continue to have little impact here, but we're planning if we don't. So we're real focused on that. I will also say that I feel like our physicians and our staff have done a really good job of planning and preparing for this. Luckily, we've been learning from other parts of the country, and as well as with Dr. Veredis and the Department of Health in the city. And I feel like because when this person presented, we were following the appropriate protocols, and that really protected our physicians and our staff. And I applaud the health department and our physicians and staff for following those protocols.
Dr. Schultz mentioned yesterday that April 1 could be a date where San Angelo, Shannon certainly could be a site where it could be testing for the coronavirus and test these results here. Is there any plan to maybe expedite or certainly speed that date up, certainly with this case here?
What we intend to do is continue to preach the message of social distancing and to follow the CDC guidelines, because what we do know is the way we will have to extend that deadline if, in fact, people do not pay attention to the CDC guidelines. And that is 6 feet between people, social distancing, no gatherings of 10 or fewer people, constant sanitizing. These are the key issues to stopping the spread of this. If we can stop the spread and we see the numbers not escalate, but perhaps even de-escalate in other counties, surrounding counties, or in the state of Texas, then we won't have to extend the deadline. This is a daily issue. It's an evolving issue. When we see the numbers going down, we can talk about deadlines. Right now, those are the deadlines. They're firm. And what we do ask, follow the CDC guidelines. Social distancing is the #1 issue. 6 feet between people, no gatherings of 10 or fewer people, or gatherings of 10 or fewer people. These are key issues. And if we do the right thing, we will be okay. We still know that in this city, people are hoarding. We need to make sure people understand grocery stores are getting regular deliveries. We are not going to be out of product. There's probably enough toilet paper in some households for the next 3 years. We need to make sure hoarding stops. HEB is limiting the number of people who can go into their grocery stores so that they are protecting as much as possible. But we have to follow these guidelines. This is not a joke. This is not funny. We've got to follow those guidelines, because the only way we will move forward and get out of this isolation issue is to follow the guidelines. This is a firm request to all of the citizens. Follow the guidelines. People have asked if they can go out and walk their dog and take a walk? Yes, you can. But remember, social distancing is important. The same thing with our parks. If you're going to walk along the river, if you're going to be out, you've got to maintain the social distancing. This is key. People have asked aggressively about what about nail salons and hair salons. You cannot work on a customer and stay under the following guidelines of 6 feet between people and do hair and nails. You cannot do that. These are serious. We are asking for essential businesses only to be open. If you have a question or concern about what an essential business is, contact Teresa James or teresa.james@cosatx.us. She will answer your question immediately. Essential businesses only. And of course, we know food is an essential business. We know getting fuel is an essential business. We know medical issues are essential businesses. We know hardware stores are essential businesses. And there are others. But if you have a question, you're having concern, you're not sure what essential business is, find out. We'll answer your questions, your phone calls, your comments, your emails quickly. This is what we're asking of all citizens. We've had one positive case. We don't want more. And so if you follow these guidelines, we will protect the rest of the citizens, the rest of the people who live in this Concho Valley area. The key thing is containment. Thank you.
Hello, Sonora Scott with KSAN and KLST. First of all, I just want to thank all of you for your transparency throughout all of this. We really appreciate that. I know that y'all have had to make a lot of tough decisions, so I would just like to publicly thank all of you. Speaking to that, we have gotten updates on how many cases are out each day and how many pending cases there are, how many tests that you've done. Do you have those numbers for today?
Sandra, do you have an update on number of cases pending? She'll be up here in just a minute. Okay. She'll be right back with that information. Do you have another question you want to ask?
Yes, I know y'all are still researching about this patient who traveled, but do you have any, or can you share any information? Did he use the San Angelo airport?
He drove here.
Okay, thank you. Also, another question that we've gotten for the viewers, I know you mentioned the supplies that y'all are okay on those, but a lot of folks have been reaching out wanting to help. And we've seen folks make, sew the cotton masks,
Yes.
out of cotton material. Are those actually effective? Will you use those? Could citizens make those for y'all?
We've certainly had a lot of requests. The number one thing is making sure that they are sanitary, and there's certain guidelines. And I'm going to let Shane speak to that because there have been some very creative people thinking outside the box in terms of how they can help, and we want to encourage how you can help. So, Shane?
Well, first, we really appreciate people wanting to really help us out and share supplies, and we know there's a lot of activities around helping create masks for us, and those work really well for staff that are not in direct contact with a patient, but when staff, in order to protect the staff and the physicians, that are working with the patients each and every day, we like them to wear specific protective or PPE that is appropriate for that type of environment. So we've appreciated all the donations and everybody reaching out, and we are going to be communicating tomorrow kind of a centralized location for a lot of those supplies, and get all this kind of great generosity kind of designated to one area for all of us in the Concho Valley. We're going to start that process tomorrow. So we'll be kind of putting something out on our website and communicating. People can help us. But mainly it's donating PPE supplies. And we're actively each and every day looking at getting more supplies from around the country. There's just so much is being designated to those high impacted areas. So it's becoming really difficult for us to obtain it. And I know it feels like I'm saying we're good with supplies. What I'm trying to say is we are better than a lot of healthcare systems around the country. We're better off than them, but I am worried about what the next week, 2 weeks, 3 weeks, month looks like. So we're very focused on it.
Sandra, would you please come forward and update us on the numbers that you have as close to possible?
Good afternoon. And so we are updating these now once a day at 2 o'clock. So as of today, we had 184 total that have been tested. 69 tests have come back negative. 114 are still pending. And then, of course, we have our one positive today.
Y'all kind of spoke about this earlier, kind of giving us a peek behind the curtain, how you're planning, how you're, going about preparing for, hoping for the best, but preparing for the worst. Coming from, the city leaders, from medical professionals, the frontline people, what do you wish people knew from your perspective?
The number one thing is to follow the CDC guidelines. I can't say that enough. The CDC guidelines are what we need everybody to follow. They're proven to be effective. If you follow the CDC guidelines, that's the most important part, because it will take every citizen to participate in this and every citizen to follow the CDC guidelines. If you're the one not following them, then you can be the one who helps spread this. And so everybody must follow CDC guidelines. We repeat that you must have gatherings of 10 or less. You must social distance 6 feet. Bars and restaurants will be closed. Essential businesses will be allowed to remain open. No visits to the nursing homes or the health facilities caring for the elderly. And most importantly, clean, clean, and clean, and wipe down. Each one of us have a part of making sure this area is protected and that we are able to move forward because we've done the right thing for all of the citizens here in San Angelo. Everybody plays a part, every single citizen. And the last thing with the CDC is, of course, keeping our schools closed. That does not mean our students won't still be learning. All of the schools have addressed options and opportunities to continue that learning going forward so that our school kids don't fall into a vacuum of lack of education. We want to continue to do that. But I repeat, follow the CDC guidelines. If you have any questions, please email me. I am brenda.gunter@cosatx.us. The same thing with Teresa James. Teresa.james@cosatx.us. We respond on a minute-by-minute basis. Every citizen has a part in this, and we're begging, we're asking, we're demanding that you follow these guidelines. The health professionals can only do so much. They only have so much capacity. They only have so much equipment. So if we don't do our part, we are risking this community. Governor Abbott was very specific today at his 2:30 conference about the amount of medical supplies that he's ordering for the state of Texas, which some will come our way. That will be an important part. But meanwhile, we need to make sure that we don't have a short supply here because people aren't paying attention to the CDC guidelines.
Let me add as well that we do have our 911 line. We also have a non-emergent line. We ask the citizens that please don't call those lines asking for information. As the mayor mentioned, you can definitely contact her. You can contact my office or Teresa James. But we do have, of course, on cosatx.us, our website, we have a segment specifically for coronavirus, which we update on a daily basis. To include the numbers as far as the testing, all that information is on there as well. But we do ask that you please not contact the police department, 911, or non-emergent, asking for information. You can go online and get that information. They're already inundated with calls. Right now, what we would prefer, if you have a report on perhaps a non-compliant business, you can definitely call the non-emergent line, and we can respond with PD on those issues. But again, please, if you have any questions, go to our Facebook page or our website, and you'll have a lot of information updated every day. The hospitals are doing a wonderful job of getting their information to us as well. So we have that information there also. So again, go to our website and seek that information there. Thank you.
For Mr. Plymell, Mayor Gunter, I do appreciate you specifying and addressing the CDC guidelines. But as asked, my last question, with Dr. Schultz addressing yesterday with the April 1st date of possibly being able to test here in San Angelo, would that be pushed up sooner, or is that a possibility?
We're just going to talk about that deadline today. We have no information that says that we should or could change that deadline. That deadline is a deadline until further notice. What I would like is Judge Floyd to come forward, because we've talked a lot about the city. I want him to give us some information on the county. Judge Floyd?
There's a few points I would like to touch that arose here. One is concerning the ability to pay. The county does run an indigent health care program. It's still active. We're basically a payer of last resort, and certainly it has a threshold for income. I think we're at 125% of poverty to qualify. And so that's another option for those that truly have no other option to try to deal with that. I'm glad to hear Shane say they're not turning away anyone. They are going to treat them, but you can find their number on our office. The second thing is a little structure of how emergency management works. The healthcare component of that has been very active the last 30 days, dusting off their pandemic and epidemic plans and trying to personalize them for this situation. You should certainly be proud and give thanks to these people that have been doing that. We're as well positioned as anyone. But when the Stafford Act, when the President instituted a national declaration, it kicked in the Stafford Act, and that is the reimbursement mechanism for emergency funds. And the way it works, you exhaust or nearly exhaust your local capacity, you request from the state, and when the state starts to exhaust those, they request from the federal government. Our concern is that if we exhausted on the medical side here, there was no other place to go, is because the state would have been taxed out. The governor's conference at 2:30 was primarily focused on the medical capacities, and it was very encouraging, the amount of PPE, testing kits. They've even set up a website, www.texas.gov, that has a link on it for medical professions willing to volunteer, come out of retirement, donate medical supplies, and was very encouraged by such a robust effort for that. So that takes a little pressure off locally that there may be some help if it gets to the point that we need that. And just every day that goes on, he was talking about 1 million masks a week being delivered starting next week. So very robust response. The third thing I would like to address is, of course, we're at a certain level of restrictions under our disaster declarations. There are more restrictive steps to take, stay-at-home orders, curfews, that sort of thing. Fortunately, the governor respected the local authority for us to make those decisions. And I want to thank the citizens of the county and the city for primarily complying with the existing restrictions we set up last Thursday afternoon that the mayor went over earlier. There's a few violations that you see around. I think some social pressure might solve those issues at certain times if somebody's violating your space, to work with that. This may be a societal issue, but it's a very personal situation. Unless each of us personally takes responsibility for that, it's going to end up coming to our home at some point in time if we can't get control of that. But with that, I believe that you're in control if there's no further level of restrictions placed on the community. And that's by getting compliance, and I appreciate so far what we're getting. So I'll take any questions, but I think they've covered about anything. Yes, Joe? Nope, I'm just kidding.
Judge Floyd, obviously the Dallas County judge, the Tarrant County judge, the Travis County judge, Brazos County and Aggieland, they've all sheltered in place. What item or what data point in your mind would you have to order shelter in place in Tom Green County? How bad does it have to get, or what are you looking at as far as that? Obviously, you are looking at, the situation growing.
The period of time that we have been 10 days, I guess, been aware and bring them in. If the trajectory of the number of patients that are screened and tested and the results, if those percentages within that turn around and go completely the other way, then that would indicate a very broadening of the exposure here and the severity of that exposure. So far, those numbers have been trending fairly comfortably for me. I don't want the virus. I don't have a fear of it, but I have a healthy respect. And I'm of that age group that's supposedly the target class. But I don't want the flu anyway, whether it's COVID or whatever form. So those numbers would have to change significantly. I think by the time we felt that in this community, that decision would have been taken out of our hands and done at the gubernatorial level, because it means it is all over the place. I can't speak to what those county judges, and I think there's a city or two that mayors, what it looks like on the ground. One of the county judges responded that she was not getting any cooperation from her citizens on the compliance for an order very similar that they had issued, did not say when, I'm assuming in the last few days, that her citizens were ignoring it. And that's the reason I thanked our citizens. It's in their hands if we get anything further. But the numbers would certainly have to trend the other way. We would have to start getting overwhelmed with our response system here, and especially if we had concerns that there was not any other supplies available because of the demand across the state. In my mind, of course, the mayor may have a little different perspective on that. The second component of that, when you look at a stay-at-home order, when you look at the Homeland Security guidelines or anybody's guidelines on the exempt sectors of the population that are exempted from those orders, it seems like that we're already nearly at that level. I think practically you would not see much difference in the amount of traffic that we have moving around, because it exempts a great deal of people involved in quality of life, infrastructure, healthcare, food production, supply chain, communications. You can just go on and on and on. So I think those are the only people that are out there as active. It exempts local governments from that. So I think it's more a symbolic gesture than it is a practical application. Curfew. I don't know how in the world you would truly enforce a curfew. But again, to me, those things are much like our burn ban for the county. We've had very few fires that's actually ever been started by a violation of the burn ban. But it's an awareness situation to get people to pay attention. And that's what we're trying to do. It's in the hands of our citizens to control where we're at and not add any further restrictions on their life. I mean, we're a freedom state. That's the last thing in the world we like to do that. So it's very much in the interest of public safety that we make these decisions. And I'd rather not have to move to the next level because the facts on the ground does not dictate that action is necessary.
Mayor, do you agree with the judge?
I will say the following, that I believe strongly that citizens can control. Citizens have the responsibility. Only when the numbers dictate to us that we need to do a stay in home will we do that. Right now, the numbers do not indicate that. So at this point, we're staying with the CDC guidelines, with the direction that Governor Abbott has given us. But again, regardless of what they say, the biggest thing will be if people in this city, this county, don't follow the guidelines and create a big problem for us. Citizens will determine the next step. So we need them to make sure they're aware of what can and cannot be done, what will and will not work in terms of an essential business. But we don't want people to have to do a stay in place if in fact we can control this. Stay in place will be dictated by the numbers.
quick question, just a little clarification. So in Lubbock, they've made it where all non-essential businesses are closed. Are we doing that the same in San Angelo, or are there going to be more steps towards that, or anything like that?
Teresa, you might come forward, but there is a information on what are non-essential businesses. So there is a guideline in terms of what those are.
The answer here is that if a business can operate and maintain no more than 10 people within the facility and maintain those distances, we're allowing them to operate. As the mayor said, we've been looking at nail salons and places that do hair, and it's clear that those folks cannot maintain social distances, so we are going to be issuing more guidance to them that they do need to be closed. Does that answer your question? Any business can stay open if they can maintain no more than 10 people in a room, and there's also requirements, that you have hand sanitizer, soap and water available, that you're cleaning on a certain schedule, and that you are making sure that any employees who come to work go home if they're sick. But other than that, we're not closing people unless they can't maintain those social distancing requirements. Yes, of course, bars and restaurants. I'm assuming you're not talking about those. Yes, and there's also gyms, and there's also massage therapists. And I'm getting more questions about those two things right now. All gym facilities are closed or should be closed, and any massage therapist, even if it's going into somebody's home, needs to cease operations.
Hello, you can bring that microphone
Okay.
down a bit. There you go.
Well, maybe.
That'll help you.
I'll just kind of do this.
Okay.
Just sanitize it afterwards. So Dr. Veredis spoke about y'all were prepared. You were prepared for this. But as far as us having a confirmed case now, has anything changed the way, like when it comes to day-to-day operations as far as procedures?
It has not, because again, we go back to the CDC guidelines and what are non-essential businesses. Those guidelines cover everything. And if we follow those, we won't have an issue. But you got to follow those CDC guidelines. But I'm going to have Dr. Veredis speak to that more specifically.
Question directly, no, nothing's changed. We were treating patients as if some of them probably had COVID-19 already. The positive test is indeed just a positive test. We go off what their clinical status is. It's been a couple of weeks now at least that you come in the emergency department, everybody's got a mask on, everybody's got gloves on. We're treating everybody like they're a potential threat to us and like we're a potential threat to them. That's why we're trying to limit the number of people that come to any healthcare facility, hospitals, emergency departments, any office. Why we don't want visitors, because each visitor is a potential person who could get sick or a potential person to infect one of the healthcare workers. So, no, we're not making any changes. We're already ready for this.
Would there ever be a time where, I don't know, a range of numbers or a number specifically where San Angelo, we just couldn't, quote unquote, couldn't handle any more patients, and what would happen then?
I think worst case scenario that could happen. Unfortunately, if it's worst case scenario for us, it's probably going to be worst case scenario everywhere. I don't see us being able to ship patients out because all the tertiary centers that we would send to are already being slammed. I just don't see it happen. We're going to have to do our very best to control the disease here. If we could flatten the curve, make it so it's a 6 or 8 month course instead of a 2 month course, we've got a much better chance of being able to handle this with minimal loss of lives.
And also in the press release that was sent out, you kind of had a message of not so much fear, but as awareness. Could you maybe reiterate that?
Yeah, it's everybody as if they could, potentially have a disease that could make you real sick or kill you or kill your mom or your kids. Social distancing, like the mayor says, stay back. It's the things your mom taught you. If you got a cough, cover your mouth, wash your hands, stay away from sick people. If you're sick, don't go see other people. It's not rocket science. It's the simple things that are done correctly that saves lives, not the fancy things done poorly.
Next question. Are there any? Yes, please come forward.
Hi, Standard Times again. Earlier, Sandra Villarreal said that 114 tests were currently pending. Is that the number of people who are currently quarantined in San Angelo, or is that number higher?
Sandra, you want to address that? Or Dr. Veredas, you could answer that question perhaps?
Everybody that's tested becomes a person under investigation. They're quarantined. And again, once we get a negative test back, doesn't mean they're released from quarantine, because again, there are false negative tests. They're quarantined for the full 14 days.
Do you have an approximate number as to the number of people who are quarantined in San Angelo currently?
Sandra? It should be the same number as the tests that are pending, basically,
Okay.
or thereabouts.
Let me add this to it. There are people who are self-containing themselves at home because they have a high fever, don't know that they've been exposed, but feel better at home than out. So there are many people doing those things as we speak. They might not have been tested. They might have just had a higher temperature than normal. They might not feel great. So many people are I'm not sure what the correct terminology is, but self-quarantine themselves. So those are reasons it's hard to get a whole number in terms of what is exactly going on. Yes, Teresa.
There is a legal quarantine process that Dr. Veredas could go through. In addition to the governor's orders, the health commissioner also passed an order that gave him large amounts of authority to restrict people's movements. We have not issued any order through Dr. Veredas for people to formally be quarantined because we're seeing really good compliance. He and I have a conversation every day. Is there anybody that we need to issue a formal quarantine order for? And if they disobey that, we get a court order and then we can actually detain them. That has not been necessary here. We've had that conversation and we would detain them in a hospital. They wouldn't go to jail.
I want to remind everyone that one of the reasons that I think we're ahead of other communities is because the city of San Angelo on Monday, March the 16th, actually passed our disaster recovery plan. So we were out there effective early on. That doesn't keep us safe for forever, but we responded very quickly. And so we're ahead of a lot of our West Texas communities simply because we reacted quickly and limited the number of people initially to 50 and under, where many other communities stayed with the 200 and the 250. We didn't. We quickly reduced that number. So we're hoping that that will prove to be very effective for this community and that will be one of the reasons why we have fewer cases in some of our surrounding communities. There's no guarantee. But as I said before, we are communicating daily. We are responding daily. The number one thing we all need to do is communication. We owe that to the citizens. We need to be communicating daily and let you know what's going on and what steps might need to be taken. But right now, it is follow the Cdc guidelines.
One last question. We understand that medical professionals and health officials are limited into what they can disclose due to HIPAA policy. Can city officials explain their justification as to why they are not telling citizens what country this individual came from or where they may have traveled prior to coming to San Angelo?
We are protecting people's privacy. We are a smaller community. And so those sorts of details, what we're actually required to do is not give any details that could disclose the identity of a person. And the smaller your community is, the more likely those kind of details could disclose a person's identity. We don't see necessarily that there's a medical need for the community to know that. It's not going to increase the level of protection for our city if you know those kinds of details. So whether how many tests we have, how many positives we have, how many tests are outstanding, what the circumstances are for this positive test, we feel is sufficient to give the community enough information to protect themselves while protecting the privacy of our citizens.
Are there further questions? If not, we will conclude this meeting. And again, we've given you places to communicate and ask further questions if you have it, and certainly for the public to know how to reach us if they have additional questions. So At this point in time, we will end this public meeting, public announcement meeting. Thank you.